How many times in the operating room while implanting a bone screw have you been handed the wrong depth gauge, the incorrect guide wire, or managed an inexperienced scrub tech? We've all been there as surgeons. I'm Dr. Douglas Pacaccio, and I'd like to show you a new device by Merete Technologies, the Chronoceptor. Stay tuned. In a moment, we're going to show you what you can expect from the Chronoceptor with a commonly performed bunionectomy procedure.
Okay, let's begin. And before we do, I want to say that we film both bunion fixation techniques under my normal pace for each bunionectomy to compare apples to apples based off of the understanding that each of us as surgeons operate at our own rate and technique stepwise. In other words, view this video as a comparative to my style and try to apply your own style as you view the progression. Obviously, if you want to try the technique, your Merete representative will be happy to get you in front of this set. The step to temporarily fixate the capital fragment is surgeon preference, as well as certain other steps. However you perform these types of procedures in detail, the Chronoceptor should streamline, simplify, and speed up your implantation of screw hardware in any application you see fit. Here we begin our screw fixation of our completed osteotomy. Notice that the Chronoceptor combines guide wire, drill, countersink, and depth gauge. Pay close attention to the number of steps required in the lower screen, while on the top screen we are already implanting a Merete Mecron bone screw. We are using a sawbone model for this video. In real life, I push my wire through the bone after measuring screw length and clamp to avoid the all too often occurrence of the guide wire coming out with my drill bit. Whether I have to add the step of clamping or fish the wire out of the bit to replace into the screw hole, both are less than ideal. Notice here in the top screen that at about 1.5 minutes, we have both screws in our head bunionectomy for 2 points of fixation and still have not completed the first screw using traditional instruments. We're going to proceed in real time so you can continue to count the handoffs for traditional instrument screw placement. Then we will speed up the video of the second screw to save time and show you the final laps for the traditional 2 points of fixation. Overall, by reducing the number of instruments, this is about simplifying technique and improving efficiency in your OR while performing everyday procedures. In conclusion, you'll see that in our model, after completing a chevron head bunionectomy, the Merete Chronoceptor required about 90 seconds to implant 2 points of screw fixation versus about 5 minutes plus for the traditional hardware. This would also apply to midshaft procedures, phalangeal osteotomies, and many other procedures that require screw fixation. Finally, we would like to mention that the Chronoceptor comes with the top shelf Merete Mecron screws, and we encourage you to check out the improved tracking, torque to implantation, and pull-out strength of Merete's new 2.0 to 4.0 millimeter cannulated screw set.